Transmite en su canal de frecuencia modulada e estereofónica multiplex La Voz Radio, desde New Haven, Connecticut, al mundo.
Hola, buenas tardes, good afternoon. Como siempre, aquí estamos con Juntos Podemos, Together We Can. My name is Caprice Taylor, mi nombre es Caprice, y hoy tengo el gran placer de introducir un doctor trabajando en nuestro vecindario aquí en New Haven, Connecticut, el doctor Ogbuagu. Ogbuagu. Y lo vamos a llamar, él dice que insiste con su primer nombre, el doctor Onyema. Welcome, Dr. Ogbuagu.
Thank you, Caprice. Thank you for having me.
And what a pleasure to have you here with us today. We've heard so much about COVID and so many discussions around COVID, but what a blessed opportunity to have you on our show today. And for the listeners, they're aware of our theme. We celebrate co-creators of a kinder and more just world. And we get to celebrate you today.
Wow.
Que aquí todos de los que están escuchando saben, nuestro tema es siempre celebrando co-creadores para un mundo más justo y más gentil. Y hoy tenemos con nosotros el doctor Ogbuagu. Y lo quiero decir bien rápido. I want to say it really fast and then I have to slow down. I'm so excited to have you on our show today. El doctor ha trabajado fuertemente por décadas y resulta de que él mismo, por la primera vez en su vida, trabajando directamente en creando soluciones sobre los virus que impactan negativamente a la humanidad, por la primera vez, sus investigaciones, su esfuerzo, él mismo pudo salvar su propia vida y la vida de su familia, porque cuando empezó en este camino como doctor, como científico, como investigador sobre viruses, nunca pensó que él mismo tener la oportunidad de poder beneficiar directamente sobre su gran labor. El doctor Ogbuagu es uno de los co-creadores de la vacuna, una de las vacunas contra el COVID. Y es el gran honor y placer en tenerlo aquí con nosotros. What a pleasure to have a co-creator of a kinder and more just world, where I just wanted to share fairly quickly. I asked for you to join the show because I've heard of your story that you shared with someone that I know, and no one really knows this in the public, the trajectory of the life journey of a scientist, of a doctor, of a researcher, researching viruses that negatively impact humanity, humankind, the human biology, researching decades, trying to find a cure, trying to find preventive measures so that human beings would not die. And you've done this research for a very long time and never thought of directly benefiting from it, directly saving your own life, directly saving the lives of your loved ones, as well as, and only started in this journey to help the community at large. And then comes COVID, where you were able to directly benefit, directly save your life and your loved ones by getting vaccinated, where you were one of the co-creators of one of the vaccines that we've been implementing globally against death, caused by COVID. So what an honor to have you on this show today. And I'd love to have this time to hear about your personal journey as a scientist. And I'd love for people to join us as well on Facebook Live through La Voz Hispana de Connecticut on Facebook. That is La Voz of Connecticut. You can catch us live on Facebook. Para vernos en persona por video, también pueden entrar a la página de Facebook en vivo en este momento, detrás de la página La Voz Hispana de Connecticut. And so, Dr. Ogbuagu, tell me, what drove you to want to be a scientist, a researcher, being a doctor in the medical field? Where did this inspiration come from?
Yeah, thank you so much for the very kind introduction. And, there's many people, many healthcare workers, scientists, researchers who have worked really hard on addressing some of the most pressing diseases of our time. And it's a pleasure to be one of them.
And what inspired you?
Yeah, so I was born in the US, but I went back to my country, Nigeria, at the age of 5 as a kid and stayed there through completing medical school. So I actually trained outside the US and came to the US to do my specialization in internal medicine and infectious disease. There was something powerful about going back home. And as many of you can imagine, it's a low resource setting and where we struggled with many disease conditions, but more prominently infectious diseases such as malaria, tuberculosis, and HIV.
And so as a child, being born in the US, that is really interesting to me because that means you had US citizenship, most likely, and which allowed for you to be a practicing doctor in the United States, where that hurdle for many medically trained outside of the US certified doctors is very hard to enter for the first time in the US and utilize that knowledge, that wisdom to the benefit of all through the medical field. And you were able to do that with the blessing of having that US citizenship. That blessed us all.
I will say that even though I was born in the US and has citizenship, but it didn't make the hurdles any less for me. And I'll tell you why. Because I went to medical school and had my medical training in Nigeria. And so when I relocated to the US, I had to go through the same process that any immigrant would have to go through to validate your medical credentials, write board exams. And I think that is really the beginning of my story, where when I was training in Nigeria, even though we didn't have all the resources that we needed, our professors always reminded us that medicine is a global profession, and that even if we were trained with limited resources, but that we should apply ourselves to being the best that we can. And, both my parents are actually college professors. They're not in medicine at all. They're in different, political science and sociology. But both of them, very early on, instilled in me the love for academics. Just that, having that ever curious, ever inquisitive mind and applying yourself to studying and the pursuit of knowledge. So, and then one other important point to make is that, like I previously mentioned, infectious disease remain a huge issue in that part of the world. And just as about the time I had just graduated from medical school, HIV was a big issue in Nigeria. One of the places that I worked in Nigeria prior to coming in was a rural area where the prevalence of HIV was as high as 20% among young reproductive age individuals. I think, looking back in my life, I think that really created a burden in me, seeing young people, young families being destroyed and decimated by infectious disease and at the prime of their lives. I thought was really unfortunate. So somehow I think that caused me to devote myself to infectious diseases and viruses.
Now I'll translate. Thank you so much for sharing your personal story. El doctor Ogbuagu acaba de decir de que la inspiración de empezar la trayectoria como doctor, como científico, como académico, empezó reconociendo de que a los 5 años de edad su familia se mudó de los Estados Unidos de vuelta a Nigeria. Él nació aquí en los Estados Unidos, pero empezando con los 5 años de edad, empezó su trayectoria académica en Nigeria y finalizando como doctor licenciado en médico en Nigeria. Es decir, todo su entrenamiento médico fue en África, en Nigeria. Y sus padres eran profesores universitarios y le inculcaron curiosidad, el querer aprender, querer aplicarse también en la parte académica, pero creciendo en Nigeria, anotó que es un país con bajos recursos, sea pudiendo combatir varias enfermedades contagiosas. Inclusive cuando él estaba creciendo en Nigeria y entró la pandemia de SIDA, el SIDA, HIV/AIDS, SIDA, 20% de las personas jóvenes que ya estaban a tiempo a poder tener familias, tener hijos, 20% de esas personas de esa edad tenían el SIDA y estaba viendo directamente cómo es que estaba destruyendo a familias y a jóvenes en Nigeria. Y de ahí sintió la responsabilidad de ser parte de la solución contra esa enfermedad y lanzó su carrera como investigador contra viruses que impacta negativamente a la humanidad. And your story just highlights how if we welcome the brilliant minds and hearts that are coming to the US and give them the opportunities to offer their talent, their gifts, their passion into the world, beautiful things can happen. And I actually worked in DC in public health for maybe about 5 years. And we had a community public health outreach worker. He was 70 years old, former doctor from El Salvador. And when he moved to the US fleeing wars, he was a cab driver, could not practice medicine because he did not have the proper immigration status. It was off and on temporary protective status. But it makes me sad to think of where society could be if all immigrants were welcomed and you had a lot of difficulties and hurdles to get to where you are now, coming from getting educated in another country. But I just want to say thank you so much for not letting yourself give up, right? Thank you so much. And so you started in your scientific research with HIV/AIDS. How did you come across COVID, the virus, before it even hit the news, before it even hit our shores? Si nos puede describir un poco sobre su carrera que empezó tratando de buscar una manera de salvar vidas contra el SIDA y cómo es que entraste en investigar sobre el virus COVID antes que llegó a este país el virus COVID.
So it's a very interesting question you ask. And I think that, first of all, those of us that have been involved in HIV medicine can draw very many parallels and similarities between HIV and COVID-19. Both are global pandemics, so they affect people all parts of the world. Both diseases affect disadvantaged individuals, the socioeconomically disadvantaged, immigrant, minority populations in the United States and even in other parts of the world for low and middle income countries. And also, we've been battling for decades to try to identify not just treatments that work, but also ways to prevent people at risk for the infection. So why I'm saying this is that, HIV researchers like myself do have a background in virology. And so you can imagine that once we got wind in end of 2019, early 2020 of this new virus that had emerged, we already had background knowledge about viruses. We already had background about how diseases spread. We already understood how diseases can disproportionately affect disadvantaged communities. And so, it really was an easy switch or pivot. And interestingly, a lot of my colleagues in HIV research have taken the lead with leading a lot of the COVID trials around treatments, prevention modalities. And so, we're happy to be in that league.
Que el doctor Ogbuagu quiere enfatizar de que el estudio de HIV, el virus que causa SIDA, hay muchas cosas paralelas con lo que sucedió con lo de COVID. Los dos virus lamentablemente impactan más fuerte a las personas de bajo ingreso socioeconómico, también a las comunidades de inmigrantes, también notando de que es importante hablar sobre el SIDA y también COVID, no solamente en la parte de tratamientos, pero también con lo de prevención, investigando maneras de prevenir. Y los dos virus son sumamente contagiosos y lamentablemente impactaron a nivel pandémica, a nivel global. Y estos dos es importante, como dijo un profesor de los estudios médicos aquí de los Estados Unidos, que el doctor Ogbuagu también tuvo que retomar certificación para hacerse médico aquí en los Estados Unidos, y se ingresó también a estudios aquí en los Estados Unidos sobre medicina, y su profesor dice, es importante reconocer y levantar la sabiduría médica que existe a nivel global, no solamente aquí en los Estados Unidos. Y con lo de COVID hubo una gran ventaja de la sabiduría a nivel global científico, la sabiduría científica a nivel global contra virus contagiosos, inclusivo, no solamente contra el SIDA, pero también con COVID. Y entonces para los doctores que estaban trabajando, muchos contra el SIDA, prevención y tratamiento de SIDA, muchos de ellos son los líderes contra lo de COVID. So I just reminded folks what you shared earlier, how that wisdom and knowledge, medical knowledge, exists beyond the U.S. borders. It's global. And we got to actually benefit from that global wisdom directly with COVID, because I recall colleagues in the beginning of when COVID hit, and in our communities, one individual lost two family members, their mother and a brother. Shortly after, one got sick, the other one passed away as well. And they themselves got COVID like about 3 months ago now, I think it was, and they survived. And the only difference between when their mother died and their brother died. And when they got COVID was the regimen of the vaccines.
Yeah,
They're also older. De que nosotros tenemos la gran ventaja de la sabiduría global y la creación de las vacunas contra el COVID, y se anotó con una colega, su mamá se murió, su papá, su hermano se murió, que era más joven que él, y un año después le dio COVID a él, pero él tenía las vacunas, él tenía esa protección y él está vivo y no tiene efectos secundarios de haber obtenido el virus COVID. And he also is not suffering from all of the long-term COVID effects that one can have. And so, as you were saying, Doctor.
Yeah, so first of all, my heart goes out to every family that's been impacted. And, it's now it's under 500 Americans have died from this pandemic. So the death toll is huge. And I think, so again, my heart goes out to anyone who's, either been personally impacted, continues to have long-term symptoms from COVID, for those who recovered, and especially those who've lost family members, especially those near and dear to us. Now, regarding deaths, I mean, it's really unfortunate that more deaths have now happened. Way more deaths have occurred after we've had a solution than before. And the solution here we're talking about is vaccines. I would point your audience to an important study by our School of Public Health, Alison Galvani, who's a colleague, which shows that about 1 million deaths in the US and over 10 million hospitalizations have been prevented just by vaccines up through November 2021. Let that sink in. It really means that, these vaccine shots that we're promoting really have the ability to keep people from getting severely ill and in the hospital, and also preventing death, like you mentioned. And so I've actually been on a mission and to reach out to people, communities of colors, reminding them that I'm one of you, and involved very deeply in the research around not just vaccines but also treatments as well, and that we can make the greatest breakthroughs in science, but it only makes the greatest impact if our science is utilized by our communities. And so I think when it comes to COVID, that's the gap where we need to build better trust with our communities, our friends and neighbors who, come to receive care from us, that, the treatments and vaccines we're offering are potent and safe for them.
And we have a brief commercial break that lasts about 5 minutes. And I appreciate us being able to do a pause on this, because not only are you a spokesperson, but you're also a client. What is it, the hair commercial? And so we'll return right back. Do not turn that dial when you hear Spanish. As always, for our listeners, we are bilingual. Y vamos a tener una breve pausa que dura no más 5 minutos, pero el doctor Ogbuagu estaba diciendo de que es bien importante anotar de que sí tenemos vacunas que pueden prevenir la muerte contra el COVID, pero lamentablemente han pasado más muertes ahora después de la creación y implementación de vacunación contra el COVID. Más personas se han muerto que antes que la vacuna no estaba disponible en nuestras comunidades. Es decir, él siente mucho por las familias que tuvieron seres queridos que fallecieron por el COVID, y los que están sufriendo con síntomas de largo plazo, y muchos todavía se están recuperando. Y lo que sí tenemos ahora es una vacuna, y tienen que anotar de que sí pueden tener confianza en la ciencia, sí pueden tener confianza en la vacuna contra el COVID. Tuvimos la oportunidad de prevenir más de 100 millones de muertes 10 millones de hospitalizaciones desde, y estas son cifras de una investigación del noviembre de 2021. Y es importante notar que la ciencia puede salvar vidas, pero no importa si no se implementa. Y en nuestra comunidad, él siente en su corazón, en su alma, la importancia de dejar saber a las comunidades, especialmente latinas, afroamericanas, que miren, yo soy como ustedes. Yo soy una voz yo conozco las barreras que tenemos que enfrentar de comunidades de bajos recursos y ha hecho el gran esfuerzo de ayudar a la ciencia a salvar vidas, inclusive las vidas de nuestras comunidades, no solamente la gente rica de muchos recursos, pero de nuestras comunidades. And so we'll be right back to hear more from our beloved Dr. Ogbuagu. Y ya vamos a regresar con nuestro doctor que está aquí en nuestra comunidad. And thank you for making New Haven your new home.
Thank you.
Prepárense para obtener su licencia de conducir en Connecticut. Ahora en New Haven, preparamos a personas indocumentadas y documentadas. Las clases son de 8 horas obligatorias por el Departamento de Motores y Vehículos. Y estas clases incluyen drogas y alcohol y técnicas para manejar de manera segura. Estas clases también incluyen un manual para el estudio para pasar el examen escrito y 100 preguntas que posiblemente estén en el examen. ¿Por qué? Porque a nosotros nos interesa que usted pase el examen a la primera vez que lo tome. 51 de Elm Street, Suite 307, tercer piso, New Haven, Connecticut, código postal 06510. El número de teléfono 203-376-0864 o el 203-907-0361. Las clases son miércoles y jueves. Estamos certificados por el Departamento de Motores y Vehículos DMV del estado de Connecticut. Ahora es el tiempo y el momento.
El sitio especializado en comidas Epicurious decidió cambiar su dieta para ayudar a luchar contra el cambio climático. ¿Cómo? Te lo contamos en este Tu Mundo Verde. Epicurious anunció que eliminó la carne de res de sus propuestas. Esto significa que el ingrediente ya no aparecerá en recetas nuevas, artículos, newsletters o publicaciones en las redes sociales. La ganadería es responsable de casi el 15% del total de las emisiones de gases de efecto invernadero en el mundo, y la carne de res es el mayor contribuyente a esa contaminación según Naciones Unidas. Por tanto, si quieres una forma más sostenible de cocinar, eliminar la carne de res es un primer paso que vale la pena, dicen los editores. El sitio se está enfocando en alternativas a los platos con carnes de res que sean más amigables con el clima. Según los editores, sus propuestas están generando una buena respuesta de los usuarios. Desde 2019, la publicación comenzó a avanzar en esta dirección. En Pascua, por ejemplo, compilaron 45 recetas alternativas sin carne vacuna para la celebración. Las recetas viejas con carne de res sí permanecen en el sitio, pero no aparecerán en la página de inicio, dice Epicurious. Marisabel Houston, CNN, Atlanta.
La Voz Hispana de Connecticut, el único periódico que cubre las noticias locales de todas las ciudades del estado. Noticias que tienen que ver con el quehacer político, educativo, económico y social de la comunidad hispana de Connecticut. Los mejores articulistas y reporteros, el mejor contenido editorial. La Voz Hispana, la voz de todos, la voz del pueblo.
WNHH 103.5. La Voz Hispana de Connecticut.
Hello, and thank you for listeners for listening today at 103.5 FM, Juntos Podemos. And we have with us Dr. Ogbuagu. Gracias por escuchar aquí de nuevo con nosotros aquí Juntos Podemos. Tenemos el doctor Ogbuagu y estamos hablando sobre su vida personal, profesional y cómo llegó a ser uno de los investigadores principales contra el virus COVID y en la co-creación de la vacuna de COVID. And so we're here with having a wonderful conversation with Dr. Ogbuagu and your personal life journey as well as your professional journey and being one of the principal investigators and co-creators of a vaccine against the virus COVID. And so it's interesting to think that you were working for many years, for example, investigating and finding treatments and preventive vaccines against HIV/AIDS. And I'm sure you never thought of that you would actually benefit from directly in getting a shot in the arm that can save your life, that you were part of the research team looking behind a microscope, doing some fancy chemistry that looks like magic from the outside in, and you eventually got a COVID shot, right? I imagine you got the shot. Now, do you have children, and do you trust that science enough that looks like magic to have your children take a COVID vaccine?
Yeah, so I will say that one of the again, having been involved for a long time in therapeutics research, treatments, and now vaccines, you always want to make sure that anything you're introducing into people's bodies are safe. And so there's a lot of work that goes on behind the scenes to make sure that whatever we put out there is safe. And, we monitor them early on in animal studies before they progress to humans. We slowly introduce human clinical trials with smaller numbers and keep getting bigger as we start to see that those compounds are safe. And so typically before we even roll out a new treatment, we have some level of confidence that it should be safe for human use. And just wanted to put that down as a background. And you're right, having been involved with trying to identify treatments for HIV, I never thought that I would benefit directly from anything I was involved with. And, but obviously when COVID hit and we're doing the research, I also, both as a parent of kids, as a child of older parents who are vulnerable to COVID, as a clinician taking care of patients with COVID-19 as an infectious disease specialist, there were just so many reasons why I also wanted to make sure that I received a vaccine to both protect myself, but also everyone I interact with, both in the workplace, in the hospitals, and at home. And even more so, I think, making sure that my family also was protected against COVID-19. Every healthcare provider always worries, especially those of us involved in the care of people with COVID-19, that we could bring the virus home because we get exposed to it at work and we could always bring it home. And, so very concerned that even our family members, including the youngest ones, kids, were protected. And I just really want to emphasize, especially for kids, that, we are seeing now that at least, 20% about 20% of COVID cases are occurring in kids. Sometime in January, at the peak of the Omicron wave, there were about 1 million kids infected in just a week. And like we've talked about before, that having COVID can lead to long-term symptoms, and how much more significant for the youngest of our population, that if they experience long-term symptoms will be quite devastating for them. So for this reason and many more, when my children had a chance to receive the vaccine, I was super excited to have them in line. And interestingly, my 11-year-old daughter went to get her shot in December, and she got the Pfizer vaccine. And how cool is it that your daughter gets the vaccine that you helped develop, as well as my twin sons as well, who are 13. And what greater confidence can you have in a product where you haven't just been involved in conducting the clinical trials to advance it, but you feel confident to take it yourself and administer it to your family. And so I hope that is another level of reassurance to the public that we believe in the work that we're involved with.
Beautiful. What a beautiful story. So not all heroes wear capes. I hope your children know that you're a hero.
They're hard to impress, but I hope so.
De que el doctor dice de que es importante anotar cuando él empezó haciendo sus investigaciones científicas y trayectoria médica, nunca pensó que iba a poder directamente tener beneficios directos de todo el trabajo que él ha hecho en el pasado. Y es decir, ahora existe una vacuna contra el COVID y él fue parte del equipo investigando y creando la vacuna para Pfizer. Y lamentablemente 20% de los casos ahora en este momento son de niños, personas jóvenes. Y en enero, cuando hubo lamentablemente grandes niveles de el virus Omicron, hubo a nivel de 1 millón de niños con COVID. Es bien significativo ver cómo apoyar a los niños a prevenir el contacto con el COVID, porque es bien contagioso el virus y lamentablemente los niños pueden tener de largo plazo síntomas negativos, la reacción de haber obtenido el virus COVID y tener problemas de salud de largo plazo en sus largas vidas. Y es importante poder prevenir ser contagiado por el COVID para los niños. Y él es un doctor que reconoce la importancia de la vacuna, siendo un padre de niños jóvenes, también siendo un hijo de padres de edad más allá, edad avanzada. Y cuando su hija de 11 años fue a vacunarse, ella misma escogió el Pfizer, la vacuna Pfizer, y qué chévere era sabiendo de que su hija iba a obtener la vacuna que él mismo fue parte de crear, salvando su vida y a prevenir problemas de largo plazo en su salud. Y de ahí sus hijos de 13 años, gemelos también, los varones, tuvo una gran confianza en la ciencia, que se sintió bien, se sintió tranquilo y se sintió con más paz sabiendo que sus hijos tenían la vacuna que él también fue parte en crear. Y yo le dije que no todos los héroes tienen su capa y vuelan como los héroes que uno ve en las películas. Y ojalá que sus hijos saben de que él es un héroe. Y él dijo, pues mis hijos es bien difícil impresionarlos. So I don't know what else do you have to do to make your children open their eyes to see that you're a hero. Like, I don't know what else. What else? Part water? I don't know. Walk on water?
I think kids are watching, and I think that I'm sure it's leaving an impression with them at some point.
And so we did also want to talk about the science around what's happening for younger children. So where are we with that, with the COVID vaccine for younger children in early childhood?
So it's actually a very fascinating landscape. We know that the Pfizer vaccine is approved for individuals 12 years and older, which is great. I think the other two, Moderna and J&J, approved for the age 18 and above, approved for Moderna, authorized for J&J. Now, for kids age 5 through 11, there is a authorization. So it's not approved yet, but authorized in that group. And we're currently working on kids 6 months through less than 5 years. And so we're actually on in clinical trials currently evaluating the vaccine in that group. We had planned a 2-dose vaccine, but Omicron hit. And so we're now planning a 3-dose vaccine for kids within that age group. And so far, the studies seem to be going well. And hopefully we have results in the next few months to come. And just one important trivia. I mean, we're finding that for those less than 6 months of age, one of the key things that protect kids within that age is actually vaccinating their mothers. There's now many studies showing that women who are vaccinated during pregnancy can transfer the antibodies to the kids when they are born. And we think that those antibodies can actually protect the much younger kids. And also people who were vaccinated later in pregnancy tend to even deliver more antibodies to their infants. So between the youngest of the infants being covered by the mother's antibodies driven by the vaccine and the trials we're doing at 6 months age and above, I think we're moving ever closer to having vaccines authorized for every age group. And I hope in the next few weeks we'll have definitive data for the under 5-year-old kids.
Pues le pregunté, this is exciting, le pregunté al doctor, ya sabemos que hay vacunas y muchas personas han tomado la oportunidad de vacunar a sus hijos de 12 años adelante, pero ¿y qué sobre los más jóvenes de 5 a 11 años de edad? Autorizaron el uso, pero todavía no fue completamente aprobado, pero está autorizado de 5 a 11 años vacunas contra el COVID, y en este momento están implementando pruebas clínicas para los de 5 años y menos de edad, y las investigaciones están enseñando cosas bien interesantes. Por ejemplo, las mujeres embarazadas, si se vacunan, están comprobando de que pueden aumentar la defensa inmune contra el COVID para sus bebés que todavía no han nacido, y al nacer tienen su sistema inmune, las defensas fuertes contra el COVID. Y a la misma vez están viendo de que bebés menos de 6 meses tienen sus defensas fuertes. Si la mujer también recién teniendo un bebé recién nacido se vacuna, detrás de su leche maternal está dando también, fortaleciendo la defensa inmune contra el COVID para los niños. Entonces, en las próximas semanas van a haber anuncios, ojalá, sobre cubriendo todas las edades, que todas las edades van a poder tener sus defensas más altas contra el COVID. Y están haciendo estas investigaciones, aprobaron antes de Omicron, la variedad del virus COVID, antes de Omicron, estaban diciendo de que tal vez 2 dosis de vacunas para los de 12 años y menos, pero ahora están viendo que 3 dosis va a ser la manera de implementar y vacunarse contra el COVID. Y es importante anotar de que cuando uno habla sobre aprobación, autorización del uso de la vacuna, han sido años y años de estudios antes de empezar implementación de vacunar a todos en una comunidad. Empiezan con investigación en un laboratorio, inclusivo tratando contra el virus en ciertos animales que tienen genéticamente cosas en común con los seres humanos, y de ahí van a pruebas clínicas más pequeñas con un grupo más pequeño de seres humanos, y de allí abriendo el uso de la ciencia médica a nivel de la población. Y eso fue la gran trayectoria con lo del virus de COVID. And so, what a pleasure where children, babies, and all ages to our elderly loved ones will be able to no longer fear living in a world that we know COVID exists. Back to normal is really based on science. Whether we mask up or don't, now that the rates are low, I look to the science. Are we in the clear? So I ask you, doctor, are you masking when you go to the grocery store?
Yeah, so I think that even the CDC guidance shows that there's no one size fits all approach. I think that there's certain important factors to consider. Certainly, if you're immune compromised, you still probably want to maintain precautions because you're a little more vulnerable than everyone else to getting infected, even if you've been vaccinated, because you may not respond to vaccines as well. So for that group, I think maintaining the same level of caution for now is important. Second thing is, again, the virus is still circulating. And even though the numbers have gone down, I think we're all worried that in the near future, none of us can accurately predict if there will be another variant that could be very different from Omicron and then be a threat to all our treatment and vaccines. We hope that doesn't happen. So even if we're relaxing some of the measures, which makes sense because it's been literally 2 years into the pandemic, I think we should still maintain our guard to keeping an eye on the case numbers within our communities, to guide behavior. We should continue sequencing the virus to make sure we can have like an early warning system to detect variants as they emerge. And so I think, it's not time to entirely let down our guard. Again, I think we still should be exercising caution in general with regards to unnecessary travel, especially when you're going to parts of the country that could be experiencing much higher transmission than we are here locally. And then, of course, in indoor settings, again, to still maintain some caution. But I think, we all share the optimism or at least excitement as the way things are now. I think it's what's to come that no one can accurately predict.
Thank you. El doctor Ogbuagu acaba de explicar que ahora no es el momento de bajar completamente las defensas, porque uno no sabe si puede venir una nueva variedad de el virus COVID, y al momento no queremos de que no tenemos las defensas listas. Es decir, yo le pregunté, doctor, ¿usted iría al súper sin su máscara? Y él dice, de acuerdo con lo que dice el CDC, Departamento de Científica y el Centro de Desarrollo de Salud de los Estados Unidos, ellos dicen, uno mismo tiene que medir qué es lo más apropiado para uno. Es decir, si uno tiene la defensa inmuna baja por varios problemas de salud que no tiene que ver con COVID, si el sistema de uno es bajo, van a tener que seguir tomando precauciones. Y en mi opinión, es por eso que yo todavía voy a seguir usando mi máscara, porque no sé qué es el estatus del sistema inmuno de mi vecino o la persona en la par mía en la tienda. Y yo quiero cuidar de ellos. And so that's why I'm adding now my own personal opinion. I will continue using my mask where possible in public because I don't know. the immune status of my neighbor or the person next to me in the supermarket. So I'll wear my mask for them versus just for myself. It's more for the unknown and the well-being of those around me. And so we have about 3 minutes left. And is there anything that you would like to share with our listeners that you haven't had the chance to share? Tenemos unos 3 minutos antes de tener que terminar lo de hoy, la transmisión de hoy. ¿Tiene alguna pregunta, algún mensaje a la comunidad, doctor?
Maybe 2 important messages, one personal and one just about the COVID-19 pandemic and communities of color. One is just from my life story. I think when we all grow up and choose a job, and especially if we go into medical profession, we always have a dream that someday we can make a difference in the life of others. I've been doing research for HIV for many decades in a corner, not really recognized. But, sometimes, an event or a world event calls for your expertise and your inputs, and, call it luck or providence or predestination. But, that opportunity comes where you can use your skill set to make a difference for other people's lives. And everybody has a talent, everybody has a skill, everyone has a gift. And so just a word out to someone in the audience who doesn't believe in themselves, that you have something in you that can make a difference to the world, and just keep doing your thing, keep working hard, and someday your efforts will be recognized. And then the last thing about COVID-19 is just, again, we still see that there's still a lot of hesitancy to take vaccines among our communities. There's so many reasons for them. Some worry about safety, and others, don't trust, the scientific community or health systems. I really just want to get a word out, take it from one of you that, we put a lot of work into making sure the vaccines are safe and effective. They are what, we have seen that they are. We have, in many cases, benefited from them personally and for our families. And that, enough deaths already, enough hospitalizations. And I think that we have a potent tool to be able to mitigate that devastating impact on our community. So I'd really like to ask everyone who's listening, who's not vaccinated, to think about it again and think about carefully and hopefully do the right thing.
Thank you so much, Dr. Ogbuagu. And now for the translation, doctor, quisiera darles el mensaje de que a nivel personal y su vida personal, él trabajaba fuertemente investigando a nivel científico en una oficina, en una esquina, y casi no hablaba con mucha gente ahí en su esquina trabajando fuerte, haciendo su investigación, y nunca pensó que su trabajo iba a ser tan importante, que uno nunca sabe qué puede pasar en el mundo. Y él cree de que cada ser humano tiene un talento, cada ser humano tiene un sueño, un deseo, y es tiempo que todos se enfocan en su talento, en ese deseo, porque uno nunca sabe cuándo el mundo lo va a necesitar. Y él puede decir que tengan confianza en la vacuna. En este momento, en nuestras comunidades latinos, inmigrantes, africanos, americanos, hay todavía muchas personas que no tienen confianza en la ciencia de la vacuna y no se han vacunado. Podemos prevenir muertes, podemos prevenir hospitalizaciones, y ya es suficiente con las muertes, ya es suficiente con estar en el hospital, porque pueden estar seguros de que ya se ha probado que las vacunas son seguras y tienen alta eficacia. Y él está hablando como un doctor, está hablando como un científico, como un padre, como un hijo y como una persona que también se vacunó. Y mil gracias, doctor Ogbuagu, por representar no solamente la comunidad científica, pero la comunidad inmigrante, la comunidad de países que no son de altos recursos, y sí se puede, con el corazón abierto y con bendiciones de nuestra familia, que nos está impulsando a que seguimos con nuestros sueños. Y no hay que aceptar el no, pero encontrar la manera de conseguir a que nuestros sueños sean realidad. And so, Dr. Ogbuagu, just want to say thank you so much for your time today, for sharing your story, and representing not just the scientific medical community, but the immigrant community, the community of folks and individuals who've come from countries that didn't have the same level of resources. And thank you for representing also the dreamers that didn't accept no as an answer, but keep fighting and finding a way. And as a result, you are one of the co-creators of a kinder and more just world that has saved lives. And so what an honor to meet a hero. And so I just think thank you to your children for letting us borrow your father, because I'm sure you do many long work hours and you have saved many lives with their compassion and patience for your dedication to your craft. And so for all the listeners, I think we all heard it loud and clear. Let's hold our dreams dear and keep birthing them into the world, because we need it now more than ever. And mil gracias, William. Y con eso, ya nos vemos el próximo lunes. We'll be back with another show next Monday.
Nos están escuchando a través de WNHH 103.5 FM LP, La Voz Hispana Radio. Nos están escuchando a través de WNH.
Buenas tardes, soy Ana
Yeah,
María
and I
Parra
on
desde
purpose
Atlanta.
use